Hi, we did discharge planning for the client requiring ventilation therapy at home. First, we put together some information for better understanding of the presentation. The ventilation therapy is a method involving a machine that assists or even replaces a patient's breathing. Usually it is used in an ICU unit for chronic illnesses. If the patient still needs assistance breathing after an illness is over, it can still be used. There are different types of ventilation, non-invasive and invasive. Non-invasive does not involve surgery and uses a face mask or nasal tube. Invasive is considered surgery using an endotracheal or tracheostomy tube inserted directly into the airway. There are positive and negative pressure ventilations. Positive pressure is most common. This is ventilation that increases the pressure in the airway, assisting air right into the lungs. Some reasons to use ventilation therapy include when a patient has an abnormal gas exchange in the alveoli, decreased level of oxygen, increased level of carbon dioxide in the blood, CNS problems, neuromuscular problems, or musculoskeletal problems. Ventilators will help with the inhalation and exhalation and breathing by improving oxygenation and carbon dioxide elimination. Some different definitions you should know about ventilators are PEEP, positive end expiratory pressure. This creates constant pressure to prevent collapsing of the alveoli and increases their surface area by keeping the air sacs open. FiO2 is fraction of inspired oxygen. This is the amount of O2 a patient receives as a percentage. Inspiratory time, or I time, is how long it will take the ventilator to deliver the inspiratory part of the breathing cycle. This shows the different settings on the ventilators. Respiratory rate is usually 4 to 20 breaths per minute. It's the number of breaths delivered by the ventilators per minute. Tidal volume is usually 5 to 15 and is the volume of gas delivered during each ventilator breath. FAI2 is usually 21% to 100% to keep everything balanced, and it's the amount of oxygen delivered by the ventilator to the patient, as said before. Inspiratory to expiratory ratio is usually 1 to 2 or 1 to 1, unless the inverse ratio ventilation is required. Length of inspiration compared to length of expiration. Pressure limit is 10 to 20 centimeters H2O above peak inspiratory pressure. The maximum is 35 centimeters. The maximum amount of pressure the ventilator can use to deliver breaths.